Good evening. Welcome to Live United. Today we have a unique opportunity to share some more about home health care hospice community services. Last week's show featured the transportation services, both the Friendly Bus and the City Express, that are provided through home health care. One of the things we forgot to mention was that they do have an annual pass available to you. And again, you would want to reach out to Michael Arcerno, the transportation manager at Home Health Care Hospice Community Services. So one of those unique services, today we have another unique service from Home Health Care Community Services, and I'm joined today by Catherine Brott. Catherine is the Director of Customized Care at HCS, and welcome, Catherine. You know, last time I had you on the show, you were in a little bit different role over at Home Health Care Hospice. And so you've gone back to school.
Yes.
Gotten your degree.
Yes.
Now getting ready, it sounds like, to look at grad school.
Correct.
So let's talk about your new role at HCS. You know, it's such a large organization and providing so many different things. So your job sounds really critical to managing all the customer care end of people's lives there.
Yes, I'm the Director of Customized Care and also still oversee the Castle Center, which comes under Customized Care. So we provide services. We have the Adult Medical Day program, where participants can come spend the day for us while their caregivers are working. And we also provide LNA private duty services and homemaking services. So I oversee both those programs.
So let me start with the LNA piece
Sure.
first, because it's probably something that people are less familiar with, I would guess, unless they're in need of
Right.
that service and they call you. Is it only related to hospice, or is it a service available beyond hospice?
It's service available beyond hospice. Hospice is a separate department which also provides LNAs in the homes. These would be people who may need help with daily activities, maybe bathing, maybe they need someone to make lunch for them, or maybe they need a companion. So this allows an LNA to come into the home. It gives the caregiver some respite. I like to think of it as partnering with the caregivers in the home, because we know more and more people are helping out with either elderly parents or a spouse, and they need some time just for themselves and make sure they're meeting their needs along with those they're caregiving for.
Is this sort of like the visiting nurse kind of program?
It sort of is. It's with the visiting nurse program. That's a clinical portion, the skilled portion where the doctor's actually writing orders. This would be private duty, so the doctors don't write orders to say that you need a nurse in a home. We do provide nurses in the home, but it's client driven, so they would be calling with their needs, what they need during the day. They may need a nurse to take a loved one to the doctors, so we can provide that through customized care. They may need someone to come in as I was saying, as an LNA, just to help, maybe just be that companion, or just help with lunch, or help them bathe. We also provide homemaking services, so they may need someone to come in and do some basic homekeeping.
You know, I remember when my dad had Parkinson's, and when he was quite ill towards the end of his life, we had a private nursing coming in, because it was huge for respite for my mom, who was doing the caretaking. So really, really critical service. It's wonderful that it's available. Is that available to anybody in the Monadnock region? Do you have to be Keene-based?
We cover all 52 towns, all the towns that home health care covers. I believe it's a total of 52. So it is in the Monadnock region. We go as far north as Claremont.
So Sullivan County?
Yes, we do Sullivan County. We do Peterborough, that's Hillsborough County, and Monadnock.
So
County.
covering quite a broad area,
Yes.
so you have traveling nurses. If people wanted to arrange that type of service, do they reach out to you then?
They would call home health care, and do you put the number on the screen?
Yep.
Okay, they would call home health care, and they would speak with our intake department, and we do have her name is Karen, in intake that covers all the customized care details, what people are looking for help.
Good. And we'll have that number and the website and things up on the screen there for people to see. And so let's switch gears a little bit,
Okay.
because you're also overseeing the day, the Castle Center, which is
Correct.
the adult
Yes.
day center. And you more and more have grown into serving a growing population that we're seeing.
Yes, so we focus on memory care at the Castle Center, and as we know, the dementia population is growing very quickly. It's like every 66 seconds someone is diagnosed with Alzheimer's. So we're finding that people my age in that sandwich generation needs help caring for mom or dad because I need to work and we would need a safe place to put our loved ones, and the Castle Center is open 8 to 5 Monday through Friday, so it really provides a safe place for the participants to go. We have programming to help with memory and music. We find that music helps very well with bringing back memories. We do art programs. We also have a dance movement therapist that comes in and works with the participants. So we really focus on the programming to keep them involved and socialized with other adults.
So I'm going to have Dave pull up some pictures because I
Sure.
think we have some wonderful pictures
Okay.
of folks interacting over at the Castle Center in particular. So while he's pulling that up, here we have the Castle Center logo there.
So this is a manicure. All our staff at the Castle Center are LNA, so they're licensed nurse assistants, and we do have nurses on staff too. And here we're doing like a spa kind of day with them, doing manicures, and the women really enjoy that. We do some pampering.
We all love that.
Yes. And we also have volunteers that come to the Castle Center. So this is Emily. She comes in and does a music program every Thursday morning with the participants. We do depend a lot on our volunteers to come in with the skills that they have to help, just to help provide different activities for the participants at the Castle Center.
And we'll come back to that because volunteers are critical
Yes.
in lots of ways.
So this is a picture of Music and Memory, and we're actually certified through Music and Memory. They have a website where you can see different stories on how music has helped with people, also helps with agitation. We see a decrease in medications given for behaviors with dementia people when we involve music.
Nice.
And this was one of the art programs. I think they were doing self-portraits.
And that was probably one of my favorite pictures that we saw because you can see the likeness there
Yes.
between people, and so fun to see that. So some fabulous social kinds of initiatives, things really working with the memory. And I remember from you being on the show last year that the music and memory piece, that people can volunteer for that and actually be trained to work as part of that. Is that correct?
Yes, so we have volunteers that can come in and work with music and memory. We do individualized playlist. So part of that program is interviewing our participants and the caregivers with what type of music that the participant likes to listen to, and we customize the playlist. We have it all on computer, and we have personalized iPods for those who want to participate. And also, we have our volunteers listen to the music with them, and which brings out the memories and brings out great conversation.
So that's a really interesting program. I'm curious whether you've seen your population growing at the Castle Center.
We do see our population growing. What we also see is we have people who maybe will come for a few months, well, family members, some are looking for long-term placement. So when people come to the Castle Center, we're actually meeting the needs of the participant and the family. We have people that come for a few years. We have people that need like an interim place to go while they're seeking what they're going to do for long-term. And then we have people who need to work and need their loved one in a safe place, because we do know that with those with Alzheimer's, wandering can be a big concern, and you do see that in the news, people who wander and they don't know how to find their way back home. When they're at the Castle Center, we have a large space where they can walk around a lot, but yet they're safe. They're not wandering outdoors or getting lost, and family members can feel pretty secure with the safety that we provide there.
Now, I would imagine that many people think you're providing service just to elderly folks who may be experiencing dementia or Alzheimer's, but I think it's actually, you have a much broader population than
We
that.
do. So we do focus on memory care, but we do provide day programming for people without dementia, people who need socialization. We do have people that come and they'll play cribbage, they'll play other card games. And so we do provide to a broader population of people.
And what makes the service provided through Castle Center unique here in the Monadnock region?
What I like to think is the staff that we have really do enjoy being with elderly people. We take the person as a whole and see what their needs are, what their strengths, what their skills are, what we're able to do for programming for them. And we have a very unique setting because we're in the building that was an old factory building, so it's a very warm, inviting setting, and we're centrally located.
Do you find that people come in from outside the region?
Outside of Keene?
Outside of Keene or outside of even the Monadnock region?
We do have people that come outside of Keene, not so much outside the Monadnock region, because most of the people that come they're taking the bus in from Keene, or their family members are driving them in while they work in the Keene area.
So let's talk transportation for a minute, because that is something that's also provided as part of the center's care.
Correct. So within the Keene city limits, we do provide part of the program, which is all included, is transportation if you live within Keene. We will pick them up from door to door.
And I think one of the other unique pieces about the Castle Center as a place for people to be is the medical support that's available.
Yes, so we do provide medical services. We have a nurse there the whole time the Castle Center is open. We do medications there. We do simple, if someone has to wear a sling or if they're on crutches, or we stay in contact with the medical doctor. We report changes, especially with those with memory loss. If we notice big changes in them, we let caregivers know, and we let the care team, their providers know. We also sometimes have people that need oxygen, so we're able to help with that. We have people in wheelchairs. Sometimes people need feeding, so we're able to do that at the Castle Center.
So why would people want to get involved as a volunteer or support through donating the Castle Center?
Well, one, it can be very fulfilling to be a volunteer. I did have a volunteer recently tell me that they come just as much for themselves as they do for the participants. You learn a lot from the older generation. We have reminiscing groups and learning about what it was like in the 40s and 50s in the Monadnock region. I recently was told there used to be a dance place up on 101 called, I believe they called it the Eskimo, where Audrey's Cafe is up on 101. And they just find it's very fulfilling. The older population has a lot that they can teach all of us.
It is interesting. I was sharing on the last show that we've had a 92-year-old woman living with us, and she doesn't go to the Castle Center, but she, historically, like sharing her story, and she's actually had a professor collecting her story because she was a person who had left Germany during the Holocaust and actually escaped from there. And I think about those opportunities for people out in our community to go in and just be able to share a story like that, hear about what things used to be like. For our college students who may be interning over with you, and I'm sure you have lots of interns.
We do have student nurses that come through from the local colleges, and many of them find it quite fascinating because sometimes when you go in to be nursing, you think of just hospital nursing, but when they're exposed to adult day programs, it opens their eyes to new experiences in nursing. It's not all about just the bedside nursing.
No, it's about the person,
Right,
isn't it?
right.
And you really get to know a person in that kind of setting, so it's just fabulous. If somebody wanted to volunteer, what kinds of activities could they be doing? Because I know it's not just volunteering for the programs you have, but if somebody has a special skill or talent that they'd really like to share, they could reach out to you, and you could have the conversation about whether that could work.
Exactly. So we're pretty much open to a lot of suggestions when people come in with the different skills that they have for volunteering. We had someone do a book club where they would come in and do short stories weekly because many of the participants enjoy that. We have people volunteering, come in and do bingo, play cribbage, reminiscing groups, music. I'm trying to think some of the other ones that they come in. We're playing cards, some just one-on-one visits with the participants. They really enjoy just when, like us sitting here having a conversation. They can come in and visit during lunchtime, sit at the tables and visit with the participants at lunchtime. Or just bring in suggestions. We have people that come in and do crafts.
Mm-hmm. And I think you have a dance class, is that correct?
We have a dance movement therapist that comes in, and that's weekly.
So lots of opportunities for
Yes.
the public to think about what's something special that I could do, that I could offer to other people. How do they reach out to you, Catherine, if they're interested in doing that?
So they would call our main number and ask for the Castle Center, and the nurse manager would be able to assist and meet with them.
So that's one way people can be involved as a volunteer. If how would somebody know they might need your services?
Well, a caregiver might notice that they're starting to get pretty stressed and tired at home and was unaware that the Castle Center was there, but might need they might need a break for one day a week, and it might only be for 6 hours, it might be for the whole day. They can reach out. It's really looking at how the caregiver is feeling too and all this. Sometimes we just think about participants, but we're not always thinking about us as caregivers. I'm a caregiver, and really taking care of ourselves and not to feel bad when you have to reach out and ask for some help.
So again, they could just call Home Healthcare Hospice Community Services. They could also call 211 if they can't remember who to reach out to. You can call the United Way locally. We can also direct you over to Home Healthcare. Anything else you want people to know? Because we're a changing population here in the Monadnock region in particular.
Yes.
We're getting older.
We're getting older and
Hate to admit it.
not as many young people here. So just knowing what your resources are, you're not alone when you're caring for someone. There are resources, and just knowing what's out there and being aware that, yes, the population is getting older, the dementia population is growing, and it's okay to ask for help. I think sometimes we feel we can't ask for help. We're supposed to do it all on our own.
And I'm sure one of the things that people are wondering is, how could I ever afford a service like this? Is it, can you utilize your insurance, your health insurance, that kind of thing? So
for the Castle Center and for Customized Care LNA, some long-term care insurance policies, the way they're written, might cover some of the services. For the Castle Center specifically, there's grants available. VA does cover, if you're already in the system, will cover adult medical day programs. And then we also will look at income, and we'll do what we can to help you so that it's affordable.
So people really shouldn't let that be a barrier to them seeking the service. And that includes the caretaker, because I think lots of times the caretaker's in that role thinking that they can't afford some of these other services out there.
Right.
It's part of the reason why we have organizations like the United Way trying to support human services out there, but also also why you see fundraisers going on. I know you just, are you still in your poinsettia sale, or are you all done with that?
We're still in the poinsettia sale.
So, you know, again, if you don't have the time you can give as a volunteer, you have an opportunity to donate through and receive their beautiful poinsettias. So, again, people can reach out right over to Home Healthcare on that. And, you know, purchase a poinsettia, which I need to do. So what else would you want people to know?
Just look at your friends who are caregivers, and if you think this is a service that might help them, suggest that. Also look at yourself as a caregiver and realize how much you really can and can't do. And notice the elderly in your neighborhood. Watch out for them in the wintertime. You know, make sure that if you see them outside, just say hello, because sometimes they're forgotten.
And they're lonely.
They are lonely.
And we do have Thanksgiving coming up. I always encourage people, I always have a household full of people, and I make sure that I invite elderly neighbors, college students who can't go home, lots of different things. But that's a great opportunity just to reach out to someone who might be a little bit more isolated.
Exactly.
So I want to thank you, Catherine, for joining us. You know, such an amazing service that you're providing for our citizens. And, you know, one of the things I love about the Monadnock region is we have services for zero, you know, lifelong. Great services like the Castle Center, you know, and if you need even more than that, LNAs that are available to privately assist you. So, Catherine, you're doing tremendous work. Congratulations on your new degree.
Thank you.
And thank you for what you do here in the Monadnock region. And public, I want to remind you to remember that it's important to be giving of your time or resources, that whatever resource you can give to programs like this, because their survival is critical here in the Monadnock region to making a difference in our citizens' lives, and more importantly, potentially in your life someday, or someone you love and care about. So I want to thank you for joining us, and I'd like to remind you, please remember to give, to volunteer, and to advocate.